Hello, my name's Sarah, and if you're looking at this, I'm hoping that you're interested in finding out a bit more about the Band 6 Senior Practitioner for Named Patients and Section 117. My current role is Section 117 and Named Patient Commissioning Manager, so I would be a direct line manager, and just wanted to put this together to give you a little bit more information about what Section 117 is, what the Named Patient Programme is, and hopefully answer some of your questions. If any time I haven't covered what you need, please do pick up the phone and give me a call, and my contact details are as per the website. So Section 117 and named patients is basically underpinned by the Mental Health Act 1983. Section 117 and named patients sits within the personal health commissioning team at present, alongside continuing healthcare, funded nursing care, and personal health budgets. But we are slightly different in that our foundation is in the Mental Health Act rather than the Continuing Healthcare Framework. If you are a mental health nurse or practitioner, hopefully you will know what Section 117 is. If you're not, it's not a great difficulty, in the fact that learning is quite steep in any new role, but obviously we will go through and make sure that you're prepared in order to complete your role. Section 117 is for aftercare for people who have been detained under Section 3 and a couple of the forensic sections within the Mental Health Act. Once somebody has completed their inpatient treatment, they are then discharged to community onto Section 17 or a community treatment order, and then from there the Section 117 comes into play. It's a joint funded provision shared by ourselves and our two local authorities. We cover both Bournemouth, Christchurch Poole and Dorset, and there is a process by which the social care team and the healthcare team put together a package. It's priced and then it comes through to us for confirmation and agreement. Obviously, as commissioners, with any money attached to anything, it's our role to do all the checks and balances, but it's also our role to do the quality assurance to make sure that A, the patient is getting what they should be getting, and B, the appropriateness of that package of care. So we oversee and coordinate the reviews. We quite often negotiate the price of the package where possible, although quite often this is completed by a brokerage function from the local authority. Our role is very much recording and following up on information, but the role predominantly for the senior practitioner is very much to be embedded within the named patient cohort. These are those patients that are detained under Section 3 who maybe have completed their acute phase of care in our local hospitals, but then require a period of rehabilitation, and due to being detained, this is often a locked rehabilitation. So the role is very much to coordinate and ensure that those packages are being delivered, that the patients are in a quality service, monitoring through CQC, linking with the host providers of those areas, and then following up on any other queries as they occur. As part of the Mental Health Act, there are regular CPA care plan assessments, and we attend those usually by video link, but more recently by video link, but where we can go in person we will. And that is actually the only patient contact generally that we are needed to kind of engage with. There are some professional meetings, there are meetings around cohorts in relation to host commissioner functions, quality management of the hospitals. So actually, if you are a practitioner and you do want a little bit less face-to-face time, this role is very intense. It's busy, but actually there is limited face-to-face time. It is very much a document-based role, but does require kind of autonomy and autonomous working on a very regular basis.